We have many offices across the Treasure Valley, and what this will do is it'll consolidate much of that into a single location. So we've co-located complementary services like orthopedic urgent care. All of the specialty clinics will be here, hand and wrist, foot and ankle, total joints. All of those services are being consolidated into this building, and they'll work in close proximity to physical therapy, for example. When you're working in close proximity to one another, it just fosters communication. It fosters collaboration in a way that is hard to replicate when you're working across the valley. Even with technological ways to communicate through electronic health record, nothing replaces the ability to walk down the hall, tap somebody on the shoulder, and say, we need to order a test, or we need to consider a different plan of care. So those, by closing those gaps, that creates efficiencies so that the patient gets to their outcome faster.
Well, I think you could probably track my practice over 30 years and you can see the evolution of orthopedics. When I started, the majority of our surgeries were done in an inpatient tertiary hospital downtown. And as we've grown and this population has grown and technology has changed, this is where you end up with this state-of-the-art place where probably 90% of our orthopedic surgery is going to be performed on an ambulatory basis, not in an inpatient hospital. We take care of patients from birth till their golden ages and everywhere in between. That includes athletes, but orthopedics is about motion, and it's about movement, and it's about getting better or getting to a better quality of life, and that's all about what we do. So it could be an athlete, it could be a grandmom who wants to be able to garden, it could be one of my patients whose primary mobility is a wheelchair, and everything in between. So all comers will be seen here. We want our patients to come in here and see the physician in the office, maybe go down the hall for their physical therapy, go over here for all their medical imaging that they need. They can see the internal medicine doctors for their pre-op visit, pick up their medicines, pick up their crutches, and then have everything done, and then leave here and not have to go to 5 different places to get that experience. So for our patients, it's going to be transformative. And hopefully, our goal is our litmus test for success is if we have our patients leave here and go, wow, that was an experience.